Hey, it's Dr. Melissa J. Williams. I'm coming to you live, and it's all about living your best life, doing what you love. And so today, I have an amazing, one of my favorite people, right, in the whole wide world. Her name is Christine Blackledge, and she's with us, and we're just going to have a candid talk about healthcare, right? All about healthcare today. So I'm so excited to finally meet you.
I am so excited to be here. Thank you for having me as well. It's just lovely being here.
Wow. So in Atlanta.
Yes.
And so for you guys that don't know, we're just going to kind of dive in. We're going to find out who she is, right? And what she's been up to. And we're going to talk about, again, all things healthcare today. All right. So tell us everything.
I'm winning now, I can't lose. I'm living.
Okay, so I've been in healthcare for 30 years now, and I've had my own healthcare businesses as well. I'm now a coach. I've been a coach in terms of coaching healthcare businesses for 10 years, and I've decided that there was a missing link, that I needed to create a virtual assistance agency which specializes in medical and healthcare virtual assistance. And I just want to help healthcare providers to really look at being quick, fast, savvy. You need to get with the program. We need to be able to look at technology and to increase using it in our profession that we're doing so that there's better patient outcome. So that's what I'm here for, and I'm really excited to speak with you, Dr. Melissa.
Oh, I love it. So a little back story for us. I actually met Christine probably now, maybe 2 years ago.
Yes.
Maybe 2 years ago. And I met her through a colleague of mine that actually owned some home health care agencies down in South Carolina. And so at that time, so I was actually looking at a government contract,
Correct.
right? And that's how we ended up meeting. And for those of you that know, I actually own Partnership for Health, which is a home health care agency that I've owned for 15 years. And recently, I'll say recently, it's been about 2 years, I started U.S. Healthcare Nurses. And so I met Christine and we started talking about a government contract with, I think it was a staffing contract with the Department of Defense. And so that's how we met. So it's a lot that we have to catch up on because it's been a minute, but I'm loving what you're doing as it relates to virtual assistants in home health care. Because we actually have VAs, right? Virtual assistants that help us in the field of home health care as it relates to compliance, marketing, and also helping us with the aids and HR. So tell me about what your VAs are doing for agencies.
So our VAs, they go through training, and they go through rigorous training. So we train them for about 8 weeks in total, and we also make sure they're compliant, etc. And we train them in the different types of healthcare businesses and what types of tasks that will be involved in that. So it's really important that the virtual assistants are able to support the provider, because we want to help the provider to receive a higher margin. And I don't mean laying off jobs or anything like that. What I mean is to use the team members that you've got in your office that are managers, for example, senior staff members, and have the virtual assistants assist them so that they are able to do what they're meant to do in their position, and that the patients receive a better outcome, and without having all the extra additional charges of having to have additional office space, for example, holiday pay, taxes, things like that. So we provide virtual assistants. They're from the Philippines, they're from the UK, we've got them as well. We've also got South Africa as well. And it's working really well. So we've got quite a few clients that are using our healthcare virtual assistants who are trained in the medical field as well as healthcare. So we do have nurses as well that are, and social workers that are virtual assistants as well. So we really want to create that professionalism, but we also want we want the businesses to actually reduce, because we're paying so much. And I know what it's like. I've been there, worn the t-shirt, and I know that you're paying a lot of taxes, for example. So in this way, the margin is more higher, because if your clients are of a particular organization, for example, so your margins are going to be a lot less, for example, whereas your margins will be higher, the same as if you were having a higher margined client.
Makes sense.
If that makes sense.
It does.
I don't want to talk about sort of the names, for example, but I just wanted to explain that, because your margins can then increase by 50%.
Wow.
Yeah.
Wow. I love it.
And that's what I'm seeing.
I love it. I love it. So, so all about healthcare. So one of the things I know that you and I have been chatting about as we drove here today was you as healthcare nurses. Because I've been in the industry for 15 years. And so I created US Healthcare Nurses, which is a SaaS, a software company with the home healthcare providers and nurses in mind. And so again, you saw a need.
Yes.
And I saw a need as well. And for sure, virtual assistants have made my life so much easier. Yeah. So much I want to talk about, so I don't want to get ahead of me. But we talked about in the car how important it is to build the right foundation for healthcare providers, right? And so building the right foundation ultimately is going to lead to freedom, right? Because of course, we're afraid to leave our organization, right? Because we know that it takes so much to make sure that everything runs effectively. And so with the VAs, right, in place, and with building the right foundation, we as providers can step away. We can take a breather because we know that we have the right people in place to ensure that the organization can move forward. So let's talk about
leadership is so important. So the leadership, if we're not leading as care providers and doing the things that leadership involves for our senior staff members, for example, so we're then tying ourselves to that business. Like for me, for example, I'm actually on a month sabbatical because I can take time away from my business because I have virtual assistants. And I want the same for care providers to be able to do that, so they can take time away for 2 weeks without the phone ringing. I mean, I've been there myself and I have my agency. I'd be on holiday and I'm picking the phone up every day. Someone's calling me.
We've all been there. I know you guys have been there. Right?
It's not true leadership, and we need to get our mindsets into this leadership so that we can take time and breathe away from our business and know that when we come back, it's not going to fall apart. So we need to be strong leaders, and that's the reason why I do the trainings that I do to help care providers become strong leaders. And you're doing the software and things like that, which is if we've got the right technologies in place, that's going to really reduce our workload as well as care providers, and let us put some responsibility in other people's hands so that we trust them, so that they're able to do their jobs effectively by having the right software, the right tools, and we can then take time out when we need to.
I love it. I love it. So that's amazing. So another thing that we talked about earlier that I want you to share with my audience is that you actually also do coaching, right? And you coach healthcare providers or nurses to run their own successful,
Yes.
I'm gonna say that again, successful business, because we want to make sure that we're creating businesses that are not running us.
Exactly.
Right? So that's over with. We want a
Yes.
business that's successful, that we've created the right foundation, right? We've hired the right people, we've incorporated the right technology.
Yes.
And certainly if you all are in healthcare, be it a nurse, right? Because U.S. Health for Nurses is a hiring platform,
Yes.
all right? It is a charting software and it's also a lead generation software. So having one tool that does it all is important. And for me, understanding the pain points that healthcare agencies face, as well as nurses, right, made me decide to create U.S. Health for Nurses.
Exactly.
But you also saw a need, and you're now a coach, and you
Correct.
coach agencies owners, new agency owners, in how to start their business and grow and scale the right way.
Correct.
So talk to us about
Yes.
that.
So for me, when I had my business, I know the pain, I know the suffering, I know the time away from family that you're losing out on. You can't get that time back. You know, next minute they're grown up and you think, well, where's the time gone? So I really am focusing on the care providers becoming the leader and letting team members do the work that they're meant to do, so that we can be true leaders, we can focus on the income and focus on the margins, because that's important. We don't just want to be running around like headless chickens, covering this shift, that shift, when actually, how much profit are we actually making? So I want all care providers to get business quality of life, because the patient is important.
Yes.
They're going to get the best outcome, but we also, as providers, need quality of life, because we tend to be chained to the office. And I'm going to say that because I see it all the time.
Right.
So this is the reason why I've created what I've created, the coaching, so that we can help people become more mindful of their time, because we can sit at our computer and we've spent the whole day, and then you then think, oops, it's now 7 o'clock, I need to get home. Where's the day gone? What am I going to eat?
Right.
Things like that.
Exactly.
So I want the health, the mindset, I want the love, because we love what we do. We're passionate about it. We wouldn't go into something like this if we wasn't passionate. But also, we've got to look after ourselves.
And far too often I do see that, is that agency owners, they're so busy taking care of others that they fail to take care of themselves. And that's one of the things that I've actually started, and I'm going to say in the last maybe 5 years, making sure that I'm doing a better job of. And my little secret place is Panama, and I actually have a trip coming up soon. But I take a week and I'm able to go there to relax and unwind, right? And just kind of feel the sun, and the wind, and just to enjoy. But yeah, that's one of the things that we as care providers, for sure, professionals, have to make sure that we're doing. And so talk to me, because I'm really excited about this coaching thing that you have. So talk to me about how long you've been doing it.
So I've been a coach for just over 10 years now.
Wow.
So I started in 2013.
Oh, wow.
That's when I really started. Then I was traveling and doing live events where I'd have up to 1,000 people in a room, for example. And then I went online in 2018, started doing events online and coaching people how to start, as well as those that are well seasoned. So I really want to make sure that I am working with clients from beginning to 10 million plus because there's no reason why you can't make $1 billion in your healthcare business.
Yes.
So one client that we had, they've been in business for 12 years. They were able to sell their business for $1 billion.
Wow.
$1.2 billion.
Say it again.
$1.2 billion.
Wow.
So I'm also here to teach you how to look at what your exit strategy is, because we have to look at the legacy, the wealth generation, but we've also got to look at what is the exit strategies. Because at the end of the day, how are you going to push forward? Because we don't live forever, so we have to look at what is our exit plan. And whether you're going to turn your business into a franchise, or whether you're going to continue with having your business running with your company name, or you may want to sell, as an exit strategy for $1.2 billion.
I like that.
And there's no reason, because if you've got multiple branches,
Right.
then there's no reason why you can't do that. But if you build it the right way, where it's making, say, 10 million, each branch is making 10 million, then you should quite easily sell it for that amount of money. And even as a franchise model, you can be making that, and money is coming in residual. So you're getting, say, one agency, one branch is doing, say, 1 million, you're getting, say, 15-20% of that, and you haven't done anything. Now, isn't that a good business model?
Yes, that's where we're trying to
Say
get.
if you've got 5 branches, then you've got your multi-million-dollar business there, and you haven't done anything.
Autopilot is running by itself.
Yeah,
I love it. I love it. So I know you mentioned franchise. I think I attended an event that you had a couple of months back, and you were doing something with franchise. Someone had a franchise, or you had a franchise. Talk to us about that, because guys, it's so much money and opportunity in healthcare, right? And again, as Christine said, we do it because we love it, right? We're in this field because we love it. And the baby boomers, they are turning 65, in excess of 10,000 of them every single day. So there's opportunity here. There's opportunity to grow and scale. So there's different aspects, and we talked about a couple. I don't know if we talked about the government contracting part yet, but we're gonna get to that. But we're gonna talk about the franchise model, right? So you can be a mom and pop today, but then you can grow into a franchise, right?
Correct.
So talk to me about that.
So really, what I want to do is prevent people from just giving up.
Closing the
Giving up, because I've heard it, and I've seen it quite a bit, because it gets too much, and they're thinking, you know what, I'm getting 50, 60, I'm getting tired of this, I'm just going to close the door, I've had enough, walk out. So I'll give one example. One of my clients, Hannah, was feeling that way. She was actually on 2.5 million a year, and things was getting, and I'm talking about pounds here, so probably about $3 million, for example. So things were getting a bit, she was getting tired, and I said, look, why don't you do a franchise? Why don't you do a franchise model? And then the entrepreneurs who are young, teeny boppers, they've got the energy. You've been doing this for, like I said, you've been doing this for 10 years, you're a nurse, you're a midwife, you've ran this business, you've done really well, but you need to be able to look at longevity. So why don't you turn it into a franchise? And that's what she did. She turned it into a franchise. And now she's got people that want to buy her franchise model, and they're paying her, say, $20,000, and then she then gets 15% of what their turnover is. So she can have as many branches as she wants. And all she's got to do is the training for about 30 days, and then they're working it. And she wanted to open up another branch, and I said, that's going to stretch you. You're struggling as it is. Look at a franchise model and get someone in that location to do that for you.
I love it. Right,
and it's an exit strategy as well.
I love it. So hopefully you guys are listening, right? So Christine is the coach that you guys need. So we've talked about a couple of things. We've talked about the virtual assistants. We've talked about how you can change or turn your agency into a franchise. And so we're going to talk about government contracting, right? Because that's how I met you.
Yes,
that's how I met you. So tell me what you've done, because I know for sure in the U.S. that there's a shortage of nurses, hence U.S. Healthcare Nurses, right? So you guys need to download the app, join U.S. Healthcare Nurses.
Definitely.
Because there's a shortage of nurses, and so the government, especially Department of Veteran, the VA, Department of Veterans Affairs, I couldn't get that out. They're always looking for staffing, right? That's just one agency. But with that being said, there's a lot of opportunities, and I actually, because I've been doing government contracting for 32 years, decided to marry my two loves, and that's home health care and contracting. So I decided to marry the two together. And also, U.S. Healthcare Nurses is now getting ready to get on the schedule. So we will be providing staffing to the Department of Veteran Affairs. The VA. We're going to be providing staffing to the VA. And so talk to me about that aspect, because again, that's how I met you, through contracting. So how can agencies, because there's a lot of opportunities, how can agencies utilize contracting as another means of that multiple streams of income?
So I think it's important for them to decide what type of contract that they want to get, because it's okay applying for these contracts, but if you can't deliver, then it's not going to help you. You could lose all of your
credibility in the cloud.
So you've got to make sure that you can deliver. So don't apply for something because you see something and you think, oh, that's 100 million, for example, and you can't deliver, because you have to obviously show that you can deliver.
Gotta perform.
But what I would say to someone that's starting out is to start small and do multiple small contracts at the same time.
Nice.
Go for the lower value contracts. The ones that aren't so high, you've got a better chance of getting that contract. And I'm sure you agree with that. I would look at that as starting point, but then once you've got that and you've got that under your belt, then you can look at like what you're doing is branching out into different healthcare business types. So if you can try and do one at a time and then you create multiple streams, and you would have, say, for example, 5 healthcare business types, then that is where you will get to 10 million and more. But you have to start off one and do one and get strong at that.
I love it. So one of the things that I noticed when I decided to take what I do, the healthcare, and engage in contracting, was that I already had past performance. And I know I have a course, the $1 Trillion Client course, where I teach people how to engage in government contracting. And so I'm also a SCORE mentor. And what I find when people are trying to enter into the government contracting spaces, they say, hey, I don't have the past performance. And so if you're already a professional, a healthcare professional, you have past performance, right? You have past performance. So talk to me about a little bit more about some of the contracts that maybe you worked on in the healthcare arena, and where folks can even find these contracts.
Yeah, so as you know, there's
Sam.gov.
And there's a lot of private paid ones as well, which we really need to start focusing on that more, rather than the government contracts, which the margin is smaller than the higher margin. And I think with healthcare providers, what we need to start looking at is the ones that have got the higher margin. So really scrutinizing the contracts that you want to apply for, and not just going for anything. Go for something that is going to be higher margin, but also something which is manageable and at a lower value, so that you've got a stronger chance. You can even look at subcontracting, working with other organizations. That's one way of getting yourself known as well. I'm sure you'd agree with that.
I do, and that's another thing that we were talking about, is that today it's about collaboration.
Yes, definitely.
And I always quote this, and I hope I get it right. My daughter, Sabrina, says that there's no competition if you're following your divine mission.
Exactly.
So we have to get away from believing that we're competitors. Healthcare providers, we're competitors. We have to work together. So collaboration, so teaming agreement, forming joint ventures, and here we are, you're from Cyprus, I'm here in the US, and we are collaborating on various types of projects.
Exactly.
Guys, we are better together. We are better together.
We rise together.
I love it.
If we're doing one person trying to do everything, we will only hit a certain ceiling.
Exactly.
Whereas we collaborate, you've got your strengths, I've got my strengths. So whatever weaknesses you've got, I can help cover that, and vice versa.
Right.
And what will happen is it will spread, your name will spread, and then you'll get more work. So say, oh, I know this location, for example, and they've got work for you.
Exactly. It's so funny. Just gonna pivot a little bit, but my company, we actually just won a government contract in Alabama. Of course, I'm in Georgia.
Yeah.
And so what we did, and I always tell people that it's about relationship building, right? So your net worth is as large as your net worth. So I'm, of course, a member of NABWIC, which is the National Association of Black Women in Construction. And I was looking for a GC that's in Alabama to help me with a contract that I already won. And I was able to call the president and get a GC down in Alabama to help me. So guys, it's truly about collaboration, right? No more competition. And she and I are actually gonna work on some other contracts as well with DOT, because there's a lot of work out there, especially in the infrastructure arena. But if we can start as agencies, as individuals, I'm gonna even just say individuals, start understanding that we need to work together, like we can build, as Christine said, off of each other's strength. Right?
Exactly. And there's large organizations that have got contracts that they're leaving money on the table, which you can help provide the staff members to.
Just because they don't know about you. They didn't know about you, right? So we've got to get out and network. We've got to start building this bond or this bridge between what each of us do and what we bring to the table with strength. Right?
Yes.
So I try my hardest. I trademark live your best life doing what you love.
Yes.
Folks know I'm not doing it if I don't love it, right? But there's other folks, as you said, that like you have a virtual assistant agency, right? So where I'm weak at maybe staffing, Christine can help out. Where I'm weak if I'm new in the healthcare industry, I don't know how to organize, I guess, my books, my bookkeeping. I don't know where to do my accounting,
Yes.
right? So we have to learn that in our circle.
Yes.
You know, it may not be in my circle, but because I've connected with Christine, now her circle becomes my circle, and it grows and it grows and it grows. So I'm loving that. I love your saying. I say, live your best life doing what you love, but I love your saying is that we rise together. Right.
I also have the same as living beyond the horizon.
I love it.
Because we've got to push ourselves so that we get to live the future selves that we want to be.
All right, so before we go, I don't know if this is, I didn't want it to be too long, but I wanted to make sure we talked about, and it's still some more stuff that we need to, we need to talk about, some more stuff, but I didn't want it to be too long, but I want people to know how they can find you, because I know there's folks out there that need a virtual assistant. I know you guys need one, right? You probably need 2 or 3 or 4 or 5, right? So how can people find you in all aspects of what you do? Because it's all about healthcare. So everything that we talked about today is the opportunities that are awaiting us in the healthcare arena. So tell us how we can find you and all of that and reach out.
Well, I have a YouTube channel which is for women leaders in healthcare, and it's called the 7-Figure Women Leaders in Healthcare. The virtual assistance agency is a virtual assistant agency.co.uk, for example. I'm sure you'll have the link here. And also I've got the website where I'm a mentor for coaching. So I am the Millionaire Business Mentor as well.com.
I love it. I love it. Oh my God, this has been amazing. This has been truly amazing to be able to be sitting with one of my mentors, right? So if you guys don't have a mentor, I'm telling you, invest in yourself.
We all need one.
Yeah, I've got 5. I've got 5 for every aspect of my life, but it's been amazing. I love it. I love it. You guys make sure that, I know we're going to post Christine's information in the link at the bottom of this video, but connect with her. And even if you don't need her services, I'm sure you know a nurse, you know someone that's in the healthcare industry, right? You know someone that needs a VA. Share this information with them, guys. And if this video, if you liked what you saw, right, and you found any value in this video, consider liking and subscribing, right? And so again, guys, it's been truly a pleasure. As I always say, live your best life doing what you love. You only have one life, right? So live it to its fullest. Until next time, stay healthy, stay blessed. See you next time.
Have a wonderful day, everyone.
All right.